Good afternoon, everyone. I see a few folks are still connecting to audio, so we will give it a second here. All right. Excellent. Well, hi, everyone. If you have not already met me, my name is Caroline Haney. I'm the Associate Director of Career Services here at the Bloomberg School of Public Health. And we are really excited to have CareFirst here with us today. If you are living in or around Baltimore, you have probably seen CareFirst in some capacity and some signage or downtown. And so today we have Stacy, who is going to talk a little bit more about the organization and about some opportunities available. So with that, I will hand it over to Stacy.
Great, thanks, Caroline. Thank you, everyone. Such a pleasure to be with you this afternoon. I'm Stacy Murphy. I am the campus recruiting manager at CareFirst. I'm going to take some time this afternoon to talk about CareFirst as an organization, share with you a little bit of history, a little bit about how we're structured, and then we can talk about some opportunities that we have. And hopefully, we'll have some time towards the end, and feel free to pop some questions into the chat or raise your hand if you want to ask a question live. But I'll go ahead and get started. So CareFirst Blue Cross Blue Shield. Most of you, I'm sure, have heard of Blue Cross Blue Shield. CareFirst is one of 35 of the Blue Cross organizations spread out throughout the country that oversee the Blue Cross and Blue Shield plans. Blue Cross is kind of broken out geographically. So CareFirst is the organization that oversees those plans in the Maryland, DC, and Northern Virginia region. So we are what most people are surprised to know is we're a not-for-profit health plan. Our mission really is around not only administering the plans, but creating accessible and affordable and quality health care to the community and the members that we serve. We are part of that Blue Cross and Blue Shield network that works with over almost 2 million providers, hospitals, doctors, in making sure that our members can access the health services that they need. So being a not-for-profit, we also have kind of a broader commitment to impacting our community in a positive way as it relates to health and wellness, and advancing health equity and accessibility to health care. Our organization has been around 85 years, so one of the really long-term established organizations here in the Baltimore region. We are the largest not-for-profit health plan in the Mid-Atlantic region. And in addition to, the plans, we also invest in the community. Actually in 2021, we invested about $26 million to support not only other not-for-profits, but communities that are also involved in supporting health and wellness in our region. So that includes almost 300 not-for-profit partnerships that we're involved in. Because we're a large organization, we can use the revenue that we generate to invest in other not-for-profits that have a similar mission around health and wellness. So we can partner, we can provide grants and funding relationships. In addition to volunteerism, we last year volunteered almost 50,000 hours of our employee time going out and doing good work in the community and supporting them from kind of a workforce, more manpower perspective, just boots on the ground, helping out in a number of different activities. We pride ourselves in being a very diverse work environment. 50% of our workforce is minority, 70% of our workforce is female. So we feel really positive that we're nurturing and growing a diverse and inclusive workforce, and that's something that we're very invested in and very proud of as an organization. So Blue Cross across the country probably works with I don't know, close to 99% of the physicians are in network with Blue Cross and Blue Shield. We work with almost 2 million providers. 100% of the regional hospitals are all in network, and about 98% claims paid within them. So we're very far reaching, and I think it's like 1 in 3 people. Yep, 1 in 3 Americans are covered by a Blues plan. We have members in every state across the United States. So it really is a powerful network that provides a large amount of healthcare folks in the United States. So, what makes the CareFirst kind of different and from a value perspective, what guides us? We, being not for profit, have the ability to kind of look and focus on things like equity, integrity, customer first. Those are things that drive us as an organization, and the folks, that's what our team focuses on, rather than just like, hey, what's the revenue statements look like, and what are our bottom line, and are we making our shareholders happy? Our focus is on a lot of different things, more around accountability and integrity and serving the community. So the folks that work for us, we believe that we have not only a diverse team, but a very talented team of problem solvers and difference makers. We even call ourselves difference makers. It's something that we've kind of made as a tagline for all of the folks that work at CareFirst. And we're all dedicated to addressing these healthcare disparities and helping with the overall mission of the organization. So we, as an organization, pretty large, about 7,000 folks work for CareFirst across Maryland, DC, and Virginia. We have a number of different divisions and areas where we bring in new talent, information technology. We have folks in our strategic planning division. We also have health services that covers our medical management and claims management areas. We have finance and accounting, actuarial. They work on our financial statements and financial planning and kind of the traditional accounting related functions. And then of course we have marketing and communications, both for our external market as well as internal communication. So having a workforce with 6,000 folks is a need to really have clear lines of communication on a number of levels throughout the organization to make sure that we are functioning and communicating the appropriate information at the right time. Of course, we have the traditional business, human resources, real estate, those types of organizations as well. We also have an area, a public policy and government affairs area that kind of monitors everyday activity going on in state and national level government, things that may be on the horizon that we need to be aware of to make sure that we as an organization are prepared for any kind of changes in regulations or the law as it relates to healthcare. So we have a team of very talented people that kind of keep the pulse on what's happening in DC and Annapolis and Richmond.
Stacy, can you hear me? Okay. I just sent Stacy a message that she had frozen. She jumped off. I'm guessing she's going to join us in a second here, but thank you for your patience, everyone. Hi, Cece. You're on mute.
Okay, hi. Sorry, it looks
Hi, that's
like we
okay. You
lost the
froze for a
connection.
second there. That's all right.
Oh my goodness. Okay. Um, Hopefully I can kind of start where I left off,
Yes, I think that should be fine.
and I'll have to do a reshare here.
Okay.
Okay. So I don't know where I stopped, but I think I was just describing some of the different divisions throughout the organization, um, and talking a little bit about how CareFirst is kind of organized. Um, so this slide basically gives you kind of a list of the different types of job functions that CareFirst is routinely looking for talent. Um, so I will kind of leave that up there, and I'll open it up for questions if anyone has any specific areas that they want to chat about. I know that this is probably primarily focused on folks in the public health field, so we'll probably touch base in more detail about those particular opportunities. Um, but a little bit about CareFirst and why people choose to work here. I believe, have a very
Stacey, you're frozen again. I don't know if you can hear us. Can you hear me?
hello.
Hi. Oh, I can hear you now. Okay, great.
Yay. Okay, just say okay. So I have here a list of our benefits, uh, both in the area of work-life balance as well as medical care coverage. Um,
Okay. She just jumped off, so hopefully she's going to be coming back on. I'm guessing that the connection issue was just continuing. Thank you very much for your patience, guys. Okay.
and I'm back.
Okay. I was going to say maybe, yeah, maybe just coming back on will help.
Yeah, okay. So yeah, this is a list of our ERGs, our employee resource groups that allow our employees to network across the organization and connect with each other on a number of different levels and promote, diversity and inclusion across the organization. A little bit about our college intern program. We hire roughly about 50 to 60 interns a year at CareFirst. We bring on interns 3 times a year into cohorts. We have a fall, spring, and summer cohort. Um, our interns are paid. The work is really around real life work experience and meeting and connecting and learning being mentored by our professionals at CareFirst to help kind of pass on knowledge and develop professional relationships and provide opportunities for students to learn about our organization and about the field in which they're studying. So our interns during the fall and spring work about 15 to 20 hours a week, and then during the summer about 40 hours a week. So we do have a lot of opportunities that are either hybrid or remote. So if you see something posted that's in DC, it doesn't necessarily mean you're traveling to DC every day. It just means some of the team may be in DC. So keep in mind that a lot of our hybrid opportunities allow for a lot of flexibility on where you do the work. We have offices in DC, Baltimore, Owings Mills, Columbia, Reston. So lots of different places in which a person can come in and work at CareFirst. So typically we're hiring either rising juniors, seniors, or grad students into our program. Majors really depend on the opportunity that we're posting. We do hire a number of folks that do have a public health background in a number of areas, but we are typically looking for someone that has strong analytical skills, good communication skills, and just ability to collaborate and work in a fairly data-driven organization. So being comfortable with any kind of reporting and analysis is always helpful, as well as strong research skills. So that's a little bit about CareFirst as an organization. And I'm happy to open up to questions and also talk to you a little bit about some of the openings that we traditionally have for folks with a public health background.
Great.
I know, for
Thanks.
instance, right now we're currently recruiting for a couple of internship positions that have an interest in someone that may have a public health background. We have a public policy internship that we're recruiting for. We have a product management where we're actually developing strategy around a particular product line, and someone that has that public health lens oftentimes can do really well in that environment, because we need to structure and develop our product lines with that lens to make sure that people are aware of how that overall impact of our products have on the community that we serve and how effective it'll be we are in delivering that product. So I guess I'll pause here and just see if we have any questions, if that's okay.
Yeah, absolutely. I'm going to open it up so folks can come off of mute. I would encourage that if you're able to come off of mute and turn your camera on and say hi to Stacy, that would be fantastic. If not, you can also submit questions through the chat, and I'm happy to read those out. Go ahead, Sarah.
Hi, thanks. I think of the slide you showed with all the different types of jobs that you all have, which jobs or which categories would you say are most conducive to recent master's grad applicants, especially public health master's applicants?
A good question. Like for instance, we have a position that we post quite a bit. It's called a public health strategy consultant. So as a healthcare provider, we will serve kind of almost in a consultancy mode as we interact with physicians and providers enrolled in the CareFirst commercial plans, so that they can understand we can track kind of and look at patterns in their population health data and help to develop strategies that'll improve kind of the quality and reduce costs. So those folks kind of interact with those providers, provide information and consultancy around how they might influence how their practice workflow might work, and how maybe there's processes or technology in a practice that could help ensure that the provider is getting reimbursed in a timely manner, and that our members are making it successfully through the process without having too many issues, because maybe the practice isn't submitting or the claims properly or aren't coding things properly. So we can kind of step in and really serve as a consultant to those physicians or medical service providers. So that's one example of a position. We also have in the community health and like social impact area. We have folks that kind of serve as a specialist, kind of an administrative frontline to our community investments and decide like where do we invest certain funding or grants, what's the best investment, what best use of those funds. And when we get a lot of applications from organizations that are looking for support from CareFirst, kind of having that, public health lens to make sure that it's a good investment and it's going to pay off for the community if we invest in a particular organization. So, that person might be helping to look at proposals, kind of deciding, which organizations are the ones that we want to move forward in supporting. We also help, with coordinating events. We do a lot of community events, and we have staff that, are developing and inviting the right stakeholders, engaging the community in different ways through social media and other platforms, looking internally and partnering with the folks internally within our organization to see where we can get support in terms of our marketing team, perhaps putting together ads or branding around certain engagements and making sure that we have full impact for those. So those are like two examples of like what a recent, graduate of an MPH program might want to consider here at CareFirst.
Yeah, thanks.
Sure.
Actually, y'all go first.
Oh, it's okay. You can finish your question.
Oh, just really quick. Somebody else I spoke to who's connected to CareFirst tangentially said I should reach out about the graduate development program. Does that ring a bell to you?
That program is no longer operational. It was actually before my time. They did have a program in the past, but now we kind of hire just within the organization without doing any kind of a developmental or rotational program.
Okay, thanks.
Sure.
Hi, my name is Liz. I was wondering, by looking at the internships on the website, I see that you're recruiting for spring and there's spring and summer and fall internships. Traditionally do students stay on for more than one, or is there a limit at one term or interning?
It is probably more common for someone to start in the spring and continue, as long as they haven't graduated and kind of aged out of the program. We usually have folks stay, upwards to a year, kind of flipping from that part-time to the full-time schedule as the different semesters tick over. So they'll start in January, work 15, 20 hours, and then come May, they'll flip to more of a full-time schedule. And yeah.
Thank you.
But we do have some teams that like to just do a summer only program, and it's just so you'll see some that'll just say for the summer, like an 11-week engagement. Others are more like, part-time than full-time.
Okay. So when I see, would the summer internships be opened later, or are some currently open now? Because
we have some that are posted now.
Okay.
Hopefully she'll be back in a second.
Yeah, I'm back again.
That's okay. I don't
I'm
know
not
too
sure
if
if
it,
did I answer your question, Elizabeth?
Yes, that was
Oh,
helpful. Thank you.
good.
Hi.
Hello.
Yeah, I want to inquire, like I have completed my graduation from India and presently I am enrolled in masters. And it's my second term. So should I eligible to apply? I am pursuing MAS in patient safety and quality control.
So a second year grad student, is that right?
Like in second term or first
Second year.
year.
Yeah, as
Yeah,
long as you're, actively enrolled in college, you can apply for
yeah,
an
full
internship.
time matlab credit. I have taken the course.
Yeah, so for full time, obviously, you can apply for anything that you qualify for. For internships, we do require that you're actively enrolled in a degree yielding program. So either undergrad or grad school. If that
Okay.
answers your question.
Would you say there are any particular skills or that have made successful interns in the past stand out and be successful and in their programs?
Yeah, I mean, obviously, for us, an interest and a passion around healthcare is important. So obviously, public health is a good alignment for us as an organization. But we, like I mentioned, we are very much a analytical, data-driven type of organization. So having good research skills, even being able to pull information and manipulate it and display it and present it in a meaningful way is always important because we try to make decisions based on um, data and how things are working within the organization. So those are typically some of the skills that we like to see. So if you have any experience pulling data sets together, pivot tables or SQL or any kind of reporting or dashboarding kind of through like a Tableau or any of those types of tools. If you've done any statistical work, SPSS or SAS, that's always helpful as well. Because there's no matter what presentation that you're doing here at CareFirst, they usually want to see data to support your recommendations or your findings and kind of base information on and proposals based on kind of the data to support those things.
Thank you.
Sure. So I will share with you the link to our careers page, and I'll put that in the chat.
perfect.
If you are looking for internships, the best way to find them is just type the word intern into the search field, and it usually pull up anything that has, is an intern. Otherwise, it's very keyword driven. So, quotes public health into a search bar will also usually yield positions that are looking for someone that has a public health degree or a background. And keep in mind, if you are looking for a full-time position, when it says, years of experience, we also account internship experience. So if you are getting ready to graduate and it says, hey, you need a year or two experience, consider, any internship experience that counts towards that. So that doesn't necessarily mean like post-grad experience.
That's a helpful tip. I know that folks sometimes get a little scared off by seeing, that you need 2 or 3 years of experience. So that's really
Yeah.
good to know.
And then sometimes if you count up all your internships, that you usually can kind of meet that requirement.
Yeah, absolutely. Great.
Yeah.
Well, any other final questions for Stacy today?
Yeah, so I'll just put a plug in there. We've probably got about 11 or 12 interns positions posted now, and
Great.
so we're actively recruiting, and we look forward to seeing you guys in our applicant pools.
Yes,
And
yes,
thank you so
absolutely.
much for your time.
Yeah, thank you, Stacey. We really appreciate
Yeah,
you
and
taking
I'm on
the time.
LinkedIn, and I'm happy to connect with anyone who's interested in touching base. I post all my positions, so if you want to follow me, you'll always see me sharing anything that's new.
Great. Excellent.
I'll even put my little link in there too. So this is my LinkedIn.
Perfect.
Yeah.
Thank you so much, everyone, for attending today. This kind of concludes our
Yeah.
Consulting and Healthcare Industry Day. Tomorrow we have federal government, so we would encourage you to attend if you have interest in that area. And then finally, I just want to put a quick plug in for the alumni networking lunch that's going to be happening on Friday in person at the building. All of that information is on Handshake under the Industry Day tag. If you have any questions, though, you can feel free to reach out to me directly. So thanks again, Stacey. It was great to see you, and thank you all. Have a great rest of your afternoon.
Thanks very much.
Thanks.
Thank
Bye-bye.
you.
Thank
Bye.
you.